Hey mom, how you doing today?
Amazing. We got a baby.
Awesome, awesome, awesome. Well, congratulations to you and the family.
Thank you. Congratulations to you.
Thank you very much. So happy about that. Yes, indeed. All right. So we just wanted to recap our experience. So today's date is September the 10th, and you had the baby when?
Yesterday
Yesterday.
at
So
5:23 a.m. 9/9/19 on his due date.
oh, awesome, awesome. It's pretty rare, right?
It's like 2% of babies are born on their due date, so it's pretty cool.
Okay, awesome. That is fantastic. Okay, and how was labor? What kind of labor was it?
Labor was good. Labor
Labor.
was quick. It was ended in a all natural water birth, so exactly how we wanted, which rarely happens. But how we planned it, how we prayed for it, so it was a beautiful thing.
Awesome. So we will ask some questions here. And I know water birth is definitely a new topic, a hot topic amongst mothers and fathers and people who are just in the holistic community. So with that being said, with water birth, would you describe it first as the thing that was helpful in regards to just labor and dealing with your contractions?
Definitely. So water birth is definitely a new-ish idea. It's been around for a while, but as far as kind of millennials go, we're kind of just discovering it. There's only one or two hospitals in Georgia that will let you labor in the pool and birth in the pool. So some will let you just labor and then you got to get out to deliver, but the hospital that we delivered at, which was Atlanta Medical Center, will let you birth in the pool. So it definitely helps a lot. It relieves a lot of the pain. It kind of adds like a relaxing factor to it. Once you get in the water, you're able to move. I definitely didn't want to deliver him in a bed. Just the idea of having to lay there on my back, gravity just wasn't kind of making sense to me in my head. So I definitely knew I didn't want that. So having the option to have a water birth with him was kind of the ultimate goal, so that we could have the birth experience that we wanted. But yeah, it was hard, but the water definitely made it more comfortable.
Okay, nice. So I'd like to comment on that ideology that's going back to more about that the woman's body is made for this, built for this, and that laying on the back sometimes is not the most conducive way to sometimes give labor or to push something out and to conceive a child or to deliver a child. So
Well, it's definitely how you conceive a child, but
if they conceive a child.
yeah. So we watched a lot of documentaries. One of them was The Business of Being Born, and it talks about how, like, physically, if you think about it, you should not be laying on your back to deliver a baby. Like, gravity doesn't even work like that. So why have all these women been told that, like, this is, and even going to a hospital, period, like, having a baby isn't a procedure. It's not something that requires a medical professional, to be honest. It's something that your body is naturally made to do, something that women have done for thousands and thousands of years. I think the medical community has made it a procedure and made it a harder thing than it actually is, when really, like, and we got a perfect example from our midwife today, like, nobody tells your heart how to beat, nobody tells your lungs how to breathe, nobody tells your kidneys how to filter. Like, nobody's going to tell you how to birth a child. Like, your body already knows what it's doing, and it's going to do what it's supposed to do.
That's right. How is baby boy feeling today? How is he
He's
doing?
perfect.
Oh,
He's kind of in a breast milk coma right now.
outstanding, outstanding. Well, you mentioned no medical staff necessary, but did you have a medical staff, and who were involved?
Yes. So in the state of Georgia, after you've had a C-section, it is actually illegal to deliver a baby anywhere besides a hospital. So our first was a C-section. So after that, we were required by law to birth in a hospital. So we didn't have the option of a home birth or a birthing center. So we were at Atlanta Medical. We had a midwife, which I definitely highly recommend over a doctor, personally. Do your research on that one. But we had a midwife in the room and two nurses who were all extremely helpful. They knew our birth plan. They knew that I didn't want medication, so not to offer it, and kind of our views on everything. Minimal people in the room. The lights were low. My husband was playing Prince. Just they knew what plan we wanted, and they definitely adhered to that.
Nice. That's awesome. I know they have a great staff there, and Definitely an appreciation of that and getting baby Garvey here.
Shout out to In-Town Midwifery.
Yes, 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 yes. With that being said, I know you mentioned in regards of any medicine. Did you take any medicine or any prescriptions or anything? Well, I'll go ahead and name it the big shot. Did you take the big shot?
I did not take the big shot. I wanted the big shot. I'm not gonna lie. I am not gonna lie. There was a moment that I was like, oh, y'all need to give me this epidural. But my husband was like, no, that's not what you want. Trust me. And the midwife was like, you know what? We could, but it's just going to prolong things and it might take a little longer. And she kind of made a comment that by the time you want medication, it's already time to push. So by the time I was at the point that I thought I needed some help, we went ahead and got in the pool, and 3 pushes later, he was here. So by a miracle, and I'm glad I didn't. It's definitely something, like I said, your body's made for, but it definitely takes a mind over matter mindset. But just knowing that, you know, you were made for this and you could do it, it's possible.
Nice. And that kind of makes me think about preparation. You mentioned having a plan. You mentioned your husband reminding you that this is what you desire. Do you recommend having a labor plan and having a thing to where women go in, or should they go more laissez-faire, or should they just feel the baby out? What do you recommend for women in regards of
So I say kind of both.
24 hours before delivery? What do you recommend?
I say kind of both because my grandma used to always say, if you want to make God laugh, tell me you have a plan. So I know so many women that go into labor with these plans of, oh, I'm going to do this and I'm going to have this beautiful experience, and it ends up in like crazy havoc, and you go into labor on the side of 285 and a stranger delivers the baby. I don't even know. Crazy stories. So I think you should definitely have an idea, but then also, like, don't be naive and research all the options. Like, know that, okay, if I have to have a C-section, this is what I need to prepare for. Or if I have vaginal birth and I tear, this is what I need to prepare for. Or if, you know, my water breaks, my water doesn't break. If, you know, I take this medication, complications of Pitocin or complications of an epidural. Just, I would say you have 10 months to prepare. So use that time, like you spend more time studying for tests in college, so spend that time studying, learning about your body and what you're about to go through.
Awesome. The interview called for asking a question what you give back or what you would recommend to any up-and-coming mothers, but I think you just explained it there. But I would ask, would you be willing to speak on those topics and have interviews about those topics in the future?
Yeah, we're going to do some more videos now that we're on maternity leave. Some more videos and talk about it, because I think that a lot of my friends always ask me, and just like random Instagram people, but I think it's something that our generation needs to know more about, that it's not a procedure, it's not something that requires a ton of medical attention, it's something that we're meant to do, and knowing our options, knowing that water birth is a thing, knowing that birthing centers and midwives exist, and knowing that it's really your option to choose what you want to do with your body and your child and how you want to bring them into the world, and knowing your options and knowing what's out there. So educating families is going to be the goal of this, so I'm going to start it off right.
Outstanding. Well, we're going to wrap up here. Before we wrap up, and you mentioned maternity leave and respect to your job for allowing that to take place. You don't leave them unnamed. But, well, yes, I would like to ask, what do you think about maternity leave? And do you think that is something that's just not really necessary? Oh, you okay?
So we're going to do a whole video on maternity leave, but we recently learned that actually the United States is one of 4 countries, and I don't remember all of them, but I know one of them is like Libya, I think. And, well, we'll do another video, but one of 4 countries that does not mandate that a woman is paid for maternity leave, which is insane.
And how long do you think that maternity leave should really last? Anywhere from a month, 6 weeks, a year?
China gives like a year. Europe gives like a year. The fact that most commonly companies give 6 weeks is hilarious. Like, you physically need 6 weeks to go up and down the stairs without pain. Like, you need 6 weeks to start driving again. You need 6 weeks to get your body right, because a lot of the time, like, people tell you about like having a baby, like, that's all they show is this cute, look at that face. Oh my God, do you see that? All they show you is this cute little face, but they don't tell you like what your body is about to go through or just went through. And they don't show all the guts and glory of that. So knowing that you need more time to recover yourself, let alone get to know this tiny human who has his own schedule and their own, learn their cries and what they need, and God forbid you send a 6-week-old baby to daycare. Like, oh. So yeah, we're gonna do lots of videos on that. But the goal is definitely to educate and inform anybody that wants to know, because I feel like there's a lot out there.
Perfect. Thank you so much. Have a great life, Garvey. And we will be back for other videos. Thank you for tuning in. And
on our hospital bed, so we're gonna go take a shower and get some sleep.
Oh, well, shower. What do you recommend for the baby in regards of you and shower?
I'm going to take a shower. He's going with his dad.
Take care.